Hi everyone, I'm Monica,
And I'm Tiva.
and we are your Heme BMT clinical pharmacy specialists.
The roles we have in our clinics are very diverse, and our patients and providers rely on us heavily and utilize us in many different capacities. So,
There is no typical day on our clinic, but here are some things that we encounter on a daily basis. Rounding with providers. Every morning we meet with our providers. An example is with Dr. Citron, where I meet with him, his APP, his medical assistant, nurse navigator, and clinic nurse, and we meet for about 15 to 30 minutes. We discuss patients coming in for the day, patients of ours in the hospital, and any patients requiring special monitoring. It's great because they always point out what is needed from a medication or pharmacy perspective, whether it's obtaining a medication or discussing treatment options for patients. It's definitely a great showcase of multidisciplinary teamwork. Patient education. One of our main focuses as a specialist is oral chemotherapy education. Every patient requires an initial education, a 2-week reassessment, and then an every 6-month reassessment after that. Before the initial assessment, we do an in-depth review of the patient, evaluate their dosing, make any recommendations for changes, and ensure they have appropriate supportive care and prophylaxis. Then we will either call or meet with the patient in person, update their medication list, check and intervene on drug interactions, and provide the patient with information about monitoring, side effects, administration, and dosing schedules. Finally, we document our education in the chart via a full-length note. One of our unique patient populations here are the myeloma patients, which often have very complicated regimens that may lead to confusion. So an added step that we do for these patients is create and provide them with calendars for their treatment so they know exactly what they are supposed to be taken and when. Education. Specialists are the source of medication education and information here in the clinic. We are frequently called upon to provide information on new medications, toxicities, renal and hepatic adjustments, and this is for both chemotherapy and routine chronic medications. My providers feel very comfortable calling me whenever there's a question or if there's a patient here being seen that requires closer assessment of their medications or discussion about side effects.
as a blood and marrow transplant pharmacist working in an ambulatory care clinic, I play a central role in patient management and preparation for their transplant, as well as post-transplant care. Prior to transplant, I meet with the patients and their family members to provide comprehensive education. We discuss conditioning chemotherapy regimen, side effects, toxicity, immunosuppression, prophylactic medications, and vaccines. I also lead the process for prescribing all of their post-transplant supportive and prophylactic medications prior to admission to ensure that my patients are able to afford all of their medications planned for post-transplant. Lastly, I play a major role in chemotherapy conditioning regimen selection, dosing, and preparation that is customized for each individual patient. In the post-transplant care, I follow up with patients regularly to assess for drug toxicity, transplant complications, and side effect management. I am able to provide symptom management and customizable calendars for patients' medication schedules. Some of the BMT patients are on immunosuppressive medications that require therapeutic drug monitoring. I follow these levels closely and communicate any dose adjustment recommendations to patients and providers. In the clinic, I ask my patients to bring all of their prescription bottles and pill boxes to optimize adherence and ensure patients have enough medication supply. If they do not have enough supply or are facing medication access issues, I ensure the medication is obtained in a timely manner. As a BMT pharmacist, initially when I meet with patients, they are taken aback that they are receiving their treatment information from a pharmacist because they are not used to this so much in the community setting. Yet, by the end of the interaction with them and developing a longitudinal relationship, I find that I have become a trusted resource for these patients to the point that my patients call and meet with me on a routine basis for their medication management. I believe that providing our BMT patients with access to a drug expert specialized in this field allows for a well-rounded, high-quality patient care.